Hello, my name is Dina Ali, and I am excited to be returning to FDIC in 2021 to be presenting my class, Addressing Firefighter Suicide, a Proactive Approach. We've seen the suicide rate increase by 35% over the last 20 years in the United States, and we've also seen suicide impact the fire service. My class will discuss some of the risk factors that are common for all people, but more importantly, those risk factors that are common among fire service personnel. I'm proud to say that my class will focus on safe messaging in terms of talking about suicide. Rather than focus so much on those risk factors, we're going to focus on protective factors. And more importantly, we're going to focus on discussing upstream tactics that can protect us and those around us from suicide. Today, we know that most people who died by suicide were suffering from some sort of underlying mental health disorder. And sadly, most of these mental health disorders are extremely common, treatable, and nothing to be ashamed about. In fact, the research has found that nearly 60% of people who died by suicide were suffering from depression at the time of their death. What we see among our fire service personnel is that at times when they're struggling, they prefer to suffer in silence than open up. Oftentimes, this is because of fear of shame, fear of judgment. My class will discuss how we can prevent this from happening and how we can create a culture to where opening up is more accepted. There are a lot of myths out there surrounding suicide among the general population and suicide among first responders. Most of these myths are just deep-seated in stigma. In my class, I'll explain some of these myths. I'll also show you the evidence that explains why they're just myths. For example, you hear a lot of times people say that those who die by suicide were selfish. What we've learned in the research is that the least selfish people are the people who could be most likely to die by suicide, and the most selfish people are the most protected from suicide. Additionally, people fear that if you ask somebody if they're thinking about suicide, that you might implant the idea in their head. Research has also found that this is just not true. In fact, asking somebody about suicide may be the one thing that can help protect them from suicide. Because when you ask them if they're thinking about suicide, you give them the right to open up, share their struggles, and find alternative solutions. When you leave my class, I hope you'll have a better understanding of how to ask somebody about suicide and how to implement positive upstream tactics that can protect members like yourself and those that you work with from suicide. I'm super excited to be returning to FDIC in 2021, and I really look forward to seeing you in my class, Addressing Suicide, a Proactive Approach to Prevention.